So some tips for men with prostate cancer to think about as you're making decisions around complementary medicine is to first stop and pause and think about, what are my foundations for healthy living? Quite often, patients are looking for a CAM therapy that might actually reduce their risk of recurrence, and those therapies may not have been studied, or we might not know what the evidence is around those therapies. But we do know that there's very good evidence around reducing risk of recurrence and maintaining health while you're on treatment if you eat right, exercise, stop smoking, and just really have a good foundation for healthy living. Those are really important interventions to think about before you bring in complementary therapies into your treatment plan and care. Once you've had a time to think about and create a foundation for healthy living, the next important thing when making decisions around complementary medicine is to really think about, what's my goal? What am I trying to achieve by using this complementary medicine? Am I trying to support my immune system, manage symptoms? Am I doing it because my great-grandmother wants me to use a particular CAM therapy? It's really important to get clear on what your goals are so that we can match a CAM therapy to address your goals in an evidence-based way. Some tips when making decisions around complementary medicine is to seek credible information. And we know that that's not easy to do given the volumes of information available on the website. But at the CAMEA research program, we've been able to identify at least 3 key credible resources that you can search on your own or in partnership with your healthcare provider to find credible information. The first is the Memorial Sloan Kettering Cancer Center Herbs and Botanicals database. That's freely searchable from your own computer at home, but they also have a wonderful app for your iPhone so that you can search for information wherever. The second resource is the Natural Medicines Comprehensive Database, and that's considered the Bible of natural health products, and our pharmacists and our clinicians use that quite widely to look up natural medicines to understand how they relate to your conventional cancer treatment and care. And you can work with a librarian or a pharmacist to get access to that. The third is through PubMed, which is a database widely available on your own computer as well, to look at more current, recent research that's coming out that hasn't made its way into a database. And we recommend that you actually look across at least 2 of those sites to make sure that the evidence you're getting is current and up to date and actually relates to each other across those 2 databases. So once you've located your source of credible evidence, the next step is to look at the quality of that evidence. Was the research done in test tubes on prostate cancer cells, or was it actually tested in men with prostate cancer? Was it tested in people with other kinds of cancers? You want to be able to look at the evidence to see how applicable it is to you as a person living with prostate cancer. And once you've decided to use a CAM therapy, the really important part is to monitor it over time. You want to think about, how long do I want to try this CAM therapy? What's the time frame? What are my goals? How am I going to know when I achieve the goal? What's that going to look like? Are there any side effects I need to be monitoring for? And how am I going to document this over time so that I can share that with my healthcare professional to see how I'm using this CAM therapy in the context of my other cancer treatment and care?